Lecture 25.
Tuesday, today. There's my and today we'll have some comments about the exam. I underlined 10:30, and I'll make the point again at the end, but our class starts at 11, but the final starts at 10:30, and every year people walk in at 11, so try and make sure. Also, some of you have exams at Boca in the afternoon. The exam is only 75 minutes like it always is, so there should be plenty of time to get to the 12 o'clock exam without killing yourself on 995. Okay, so we got up to partially through the autonomic nervous system, discussed some general differences between autonomic and somatic nervous systems and general description of autonomic. Now we're going to get into more details about the two branches. This is one of the most important lectures of the semester because it really sets the tone for the whole control system of second semester, if you're with this next semester. So it's critical to understanding how we control so many different organ systems. So it's a big, important story. The sympathetic system, the preganglionic neurons, remember there's two peripheral neurons in each tract of the autonomic system. The preganglionic, or the first neuron, originates in the thoracic and first two lumbar vertebrae, so T1 through 12 and L1 and 2. It's because of this origination, sometimes we call it the thoracolumbar branch. It was classically called that rather than the sympathetic division. The cell bodies are in the lateral horn, right here in the gray matter, the lateral horn of the gray matter. And the axon exits the spinal cord via the ventral or anterior root and heads towards a chain of ganglia that we'll go through right now. It's in the same route as are the other somatic motor efferents. So there's a lot of different traffic in that somatic or that anterior route. There's a chain called either the sympathetic chain, or some people call it the paravertebral chain, that is a long chain of ganglia that are the cell bodies for most of the sympathetic postganglionic neurons. If you were to look at it in dissection, it looks like a silver thread that has little knots every half inch or inch down its length. So it's just this neural tract that's on each side of the spinal cord, anterior and lateral, so it's just the side of the spinal cord. And the preganglionic neuron that enters that from the ventral horn can go three different routes. So that's represented by the red line here. It can either synapse immediately with that, in the paravertebral chain right at the level of that root. So that would be this synapse right here. And then the postganglionic neuron would go out from there. But that's only one of the possibilities. It can also go up and down the chain and synapse with ganglia or cell bodies in other of the ganglia up and down the paravertebral chain, as shown in here and here, either way, up or down. Or, in some cases, it passes right through, and that's also pictured right here. So it does not synapse with the, it's pictured this way. It does not synapse with any cell body in the paravertebral train, but goes to a peripheral ganglia and synapses there, and that's where the postganglionic cell body is. So any of those possibilities exist, and indeed several of them may exist at the same time, because many of these preganglionic neurons amplify the process by synapsing with several different postganglionics, and that's brought up right here. The peripheral sympathetic ganglia are positioned near organs. There's really, in the case of sympathetic system, only three important, as I'll show you in a minute, but they're out here in in the periphery. Here's one right here. And again, that's where the cell body for the second postganglionic neuron exists. And the other thing I wanted to point out was, as I just indicated, each preganglionic axon may synapse with as many as 200 postganglionic. That's pretty rare. It's something like 1 to 35 in the sympathetic system. So the average of all of them is to synapse with at least 35 postganglionic. So definitely the response is amplified if you send out one preganglionic and it activates 35, 40, 50 postganglionic neurons going to different places. The postganglionic axons, it's a weird way to label this, but the postganglionic axon in the sympathetic system is longer than the parasympathetic. That point will be obvious when you see how the parasympathetic system is organized, but it's a significant structure. It's not myelinated, as is indicated here, but it can be quite long going to its target. So once again, the postganglionic axon is longer in the sympathetic division than it is in the postganglionic or parasympathetic division. The preganglionic axons in the sympathetic system also supply the adrenal medulla. I don't know why people keep persisting on calling it the suprarenal gland, but in most literature today we call it the adrenal gland. It's located just superior to the kidneys, and so the name suprarenal is used by anatomists, but almost every physiologist calls it the adrenal gland. So anyway, it's essentially this very large ganglia that secretes catecholamines in response to preganglionic stimulation. So it's our only source of epinephrine and a second source for norepinephrine. So when we need a large output of sympathetic activity, we stimulate the adrenal medulla, the center of this gland, and produce both epinephrine and norepinephrine. I'm going to go back before I leave this subject to one slide. Just wanted to point out there's three major peripheral ganglia in the sympathetic system. There's the celiac, the superior mesenteric, and the inferior mesenteric. Those are the three major ganglia, and actually there's no other ones that's significant at all. In the superior, it's fed by five thoracic nerves. The lesser or inferior splenic is supplied by two thoracic, and then finally down here, the superior mesenteric, and the inferior mesenteric is supplied by thoracic 12 and L1 and L2. And they feed, is pretty obvious. The celiac ganglia feeds the viscera, the upper viscera, like the liver, the stomach, the pancreas, and the small intestine. The lesser or the superior mesenteric supplies a majority of the intestinal tract, where the inferior mesenteric supplies the colon and some of the urinary tract and the reproductive structures. So anyway, those three peripheral ganglia supply most of the viscera in the system. Go back to the parasympathetic system. Okay, so the parasympathetic division, the cell bodies for the first or preganglionic neuron are found in the brainstem, up here, nuclei in the brainstem, or down here in the sacrum. So just like the other one could be called thoracolumbar, this was classically called the craniosacral division, because it was fed by neurons, cranial nerves coming from the adrenal medulla or the sacral, three sacral nerves. The cranial preganglionics that carry parasympathetic traffic are the ocular motor, shown here, the facial 7, shown there, the glossopharyngeal I mentioned before, number 9 in the vagus. And the vagus is really important, tremendous amount of traffic through there. And then S2, S3, and S4 supply the parasympathetic input to the reproductive structures and to the urinary tract. This is where the huge difference occurs, and that is the preganglionic parasympathetic fibers. There's no chain. They go clear out to the tissues that they innervate. So they're much longer than the sympathetic, and they do synapse and produce postganglionic, but they're very short, and usually the ganglia is right on the surface of the structure, except maybe some of these cranial nerves where they have peripheral ganglia. But almost all, as far as I know, all the visceral and pelvic parasympathetic innervation, the preganglionic goes right to the organ, and then right on the surface of the organ synapses with the postganglionic. So the postganglionic fibers are very, very short. So very long myelinated preganglionic, very short postganglionic. And everybody's mentions in this lecture that almost all parasympathetic innervation is carried via the vagus. 80% of parasympathetic innervation is via this one nerve. What isn't often mentioned, and the book points out, and I think I mentioned, but if not, I should remind you that there's two, and I'll point it out when it gets to the review, but there's two chapters on this material, one in the anatomy book and one in boron and Volpe. I like the boron. There's a little bit more detail. Both of them are excellent reviews of autonomic nervous function. But it's pointed out in the Barron book that although there are almost all parasympathetic innervation goes on the vagus nerve, the vagus nerve actually carries more afferent fibers than efferent. So there's more tracts coming up the vagus from pain receptors and stretch receptors and so forth from all these viscera than there is motor traffic going down. It's not classified, once again, as part of the parasympathetic system, but the vagus carries a tremendous amount of sensory or afferent traffic. And we'll bring that up all the way through second semester when we talk about control of the GI system and of the urinary system and so forth. So the predominant thing that's left is what are the effects of these two systems. There's a lot of overall general statements, and they are a good way of remembering the branches and their effects. Definitely the sympathetic system is activated during physical activity, and it's responsible for most of the coordination changes that occur, where the parasympathetic nervous system is responsible for vegetative function, vegetables, and is inhibitory during physical activity. So, for example, the sympathetic nervous system increases heart rate, the parasympathetic decreases it. So when we're going to involve ourselves in some strenuous physical activity, we're mostly functioning on sympathetic tone, if you will. In organs where the activity increases during rest, the parasympathetic system is excitatory and sympathetic is inhibitory, and a good example of that is intestinal motility. The peristalsis that occurs in the intestine is stimulated by the parasympathetic system and inhibited by the sympathetic system. And in most cases, they are opposite. There is very few examples. This began as what we call the fight or flight responses. So in response to any emergency behavior, we excite the sympathetic nervous system and inhibit the parasympathetic. So usually the responses are antagonistic. So the sympathetic system increases heart rate, parasympathetic decreases. Sympathetic causes your pupils to dilate, parasympathetic causes them to constrict. The example that we all mentioned, it seems like we have to have some conflicting thing for every universal fact, but the one conflicting complementary effect that everybody cites is salivation. Both parasympathetic and sympathetic systems increase saliva. The parasympathetic does it directly by causing the gland to produce more product. The sympathetic system seems to decrease perfusion, but you still produce lots of saliva. It's more thick and viscous, but both of them do increase salivation. I guess I don't have that very clear, but both of them increase salivation. The parasympathetic is more watery than the sympathetic. We went through details about the neuromuscular junction and about neural synapses. The autonomic synapses are specialized for what they're trying to do, and they're quite different. In other words, you can have a nerve running along the surface of the organ, and they call it varicosities, but they're little swollen areas of the nerve, and these are release sites for the nerve endings in these areas, and the receptors on the targets are just underneath. So it means that you're going to have a wider distribution of release. Many of the functions, and I introduced this last week when I was talking about general characteristics of autonomic regulation. Most of these control variables are increasing or decreasing activity, none of them are turning it on and off. So, for example, in the intestinal tract, the peristalsis will persist even after complete denervation. You'll still have waves of contraction going down the intestinal tract. But what the sympathetic system does is decrease the frequency and the amplitude of these waves, where the parasympathetic increases it. So what we're doing is releasing some controlled substances, some neurotransmitters, all along the muscles of the intestinal tract or blood vessels or wherever, and moderating the responses. The next subject is the chemicals that are responsible for mediating these responses. We talked about cholinergic and adrenergic. The term cholinergic means that particular neuron releases acetylcholine. And the classic cholinergic neuron is the preganglionic neurotransmitter for both the sympathetic and parasympathetic systems. It's also, of course, released at neuromuscular junctions in the somatic system, as we've already said. But both preganglionic neurons, both divisions, release acetylcholine and termed cholinergic neurons. It's called the receptor for this cholinergic neuron in the preganglionics and in the neuromuscular junction is said to be nicotinic. And nicotine is a drug, it's in cigarettes, which is an agonist. It increases the activity of cholinergic receptors. So when nicotine's present, all the cholinergic effects are amplified. An antagonist for nicotinic communication or nicotinic activity, receptor activity, is curare, which we mentioned before, an alpha-bungarotoxin. Both of these block the nicotinic receptors and therefore block this transmission between the preganglionic and postganglionic neurons. This particular receptor is a inotropic receptor. It's a cationic channel, just like we mentioned in neuromuscular junction, so it opens up channels that depolarize the nerve. Sodium rushes in many cases, sometimes calcium depolarizes the nerve and causes activity. So it leads to the postganglionic cell depolarizing and generating action potentials. All postganglionic parasympathetic neurons are also cholinergic, but they're called muscarinic. And that's because another agent, muscarine, that's a byproduct of one of the mushroom family, is the agonist for these receptors. So nicotine doesn't affect these receptors, but muscarine mimics the effect of acetylcholine on these receptors. And it's antagonized by scopolamine and atropine. So you've probably heard about atropine being used as a drug in certain situations. It would block the activity of postganglionic parasympathetic neurons. So when you hear about nicotinic and muscarinic responses, that's really some very specific agonists that we found out many years ago cause some cholinergic responses and not others. So we learned, this is about the first place we learned it, that a given neurotransmitter will affect different cell families different ways, sometimes because the receptor is different and causes a different response. And that's true here. Some of them are stimulated by nicotine and others by muscarine. This is a metabotropic signaling process, G-protein coupled receptor, and so it has all the characteristic of those G-protein receptors. When you signal through cholinergic postganglionic parasympathetics, the response can be inhibitory or stimulatory depending on the cell, but it will be slow, it'll have variable amplitude, and it will last a long time. All these are characteristics, as we've said before, about metabotropic signaling processes. So that's a little bit about adrenergic or cholinergic neurons. The other principal family of neurotransmitters are called adrenergic, and the principal adrenergic product is norepinephrine. It's a primary sympathetic nervous system postganglionic neurotransmitter. It's G-protein coupled receptor, and there's two major classes, and this really gets quite complex. I'm just going to introduce it, but oftentimes second semester we'll try and get into a little bit more subject. I was discussing sometimes early in the morning. I called my colleagues teaching different subjects, and I was calling one of the physiologists I know today, and talking about alpha-1 and alpha-2 receptors. He says, that's pharmacology, you don't have to teach that. And I'm sure you guys would like me not to, but it's useful, and I'll show you why in a second, but it's very useful second semester. Alpha receptors are activated by norepinephrine primarily. Now, both epinephrine and norepinephrine are catecholamines, and norepinephrine is released from neurons exclusively. Epinephrine, again, is only released from the adrenal medulla, although the adrenal medulla also releases norepinephrine. So this gets a little bit complex, but the alpha activity is mediated by norepinephrine, and it predominantly leads to constriction of vascular smooth muscle. Let me talk about that before I go on. So the sympathetic system is activated during emergencies, and during emergencies you want increased blood flow. You need a lot more glucose, a lot more energy compounds released. That's also one of the factors. But you need blood flow, blood to get out, take care of all your energy needs. Well, the majority of our blood vessels don't go to muscles. They go to the skin and the splenic bed and so forth. So because, and we're going to talk about this a lot next semester, but because of this alpha system, this alpha-1 system, we're going to constrict the smooth muscle of most of the blood vessels, and what that does is shunt blood from the viscera and from the skin and everything and make it more available to the heart and to skeletal muscle. So it constricts vascular beds that aren't vital in emergencies, so we'll have more blood to other areas. This is a little bit complex, and don't worry about memorizing alpha-2. But alpha-2 is predominantly present presynaptically on the secondary, on the postganglionic neuron, and inhibits normal sympathetic activity. So normally, sympathetic system potentiates or increases insulin, so we'll have more energy, and inhibits glucagon that does the opposite. We'll talk about this a lot next semester. But this blocks that system. So it's kind of an override, and we call it ameliorating influence. It decreases the amplitude of the response. Don't worry about it. If you learn alpha-1, I think that's amazing. Beta system is primarily activated by epinephrine, not norepinephrine, so you need mostly lots of adrenal output to cause it, and it causes massive cardiac activity. It's the primary regulator of the heart, so it really increases heart rate. It constricts or dilates the bronchioles, so it's going to increase the cardiac output. I think I have it shown in a second in more detail of how, but heart rate and strength and contraction and conduction velocity, everything has increased. It also causes your respiratory bronchioles to dilate, so you get more air to support this increased metabolism. So, and here's a very critical thing, beta 2, it causes skeletal muscle vasodilation. So although alpha 1 is constricting blood vessels in the skin and splanchnic bed, you want more blood to go to the muscles, so that's a beta 2 response. So here we have adrenergic neurons, the same neuron, in one case because of receptor family causing constriction of blood vessels, and the other case because of another family of receptors causing dilation. So it shows you how, complex and interesting the system is. There are very few sympathetic postganglionic cholinergics. It's so immaterial, don't worry about it. I just put it in there for interest. I might get into it second semester. They seem to be responsible for the sweat gland mechanism in their muscarinic. The elaboration of these different receptor families has made possible a tremendous boon to pharmacological treatment of patients, because we've developed very specific beta 1 and beta 2 receptors, so we can dilate bronchioles. Jay Lyons can breathe because of his asthma by using a very specific beta agonist, but not affect blood flow to another system. So because of all these different receptor families, we've developed all kinds of very specific drugs that work through each receptor. So just by changing the structure of the drug just a little bit, you affect one receptor and not another. This is a summary of a lot of what we've talked about in this lecture. The central system has one lower motor neuron that comes from the spinal cord and goes right to the skeletal muscle. The parasympathetic has a preganglionic that's quite long that goes to a very small postganglionic. The ganglionic neurotransmitter, or you could say the preganglionic neurotransmitter, is a nicotinic, and it's a cholinergic chemical, and it stimulates the postganglionic. It's very short, which releases acetylcholine to a muscarinic receptor. So there's all kinds of summary information here. The sympathetic system, relatively short preganglionic, goes to the ganglion where acetylcholine's again there. This is the same nicotinic type receptor. And then a long postganglionic that goes to the target, which could be smooth muscle, cardiac muscle, or glands. And that can be alpha or beta adrenergic receptors. And then this is the adrenal medulla story. The preganglionic sympathetic goes to the center, the medulla of the adrenal gland, and stimulates chromatin cells, which are the cells that produce catecholamines, that go through the blood and not only release epinephrine, but norepinephrine that's not mentioned here. So that's a nice summary of a lot. Just a couple more slides. The original idea of flight versus flight came from Cannon in 1915, so it's a really, really old, relatively old idea. And so in response to fear, fright, exercise, you need an increase in heart rate. This contractility is the strength of contraction, increases stroke volume. You need the bronchioles to dilate, and you increase the respiratory rate. So all of those provide more energy and more perfusion and so forth for the active muscles. You sweat to lose heat. Those pileoerection, we talked about the hairs on your skin becoming more erect. That's not much, kind of vestigial in humans, but important in some animals. And we release glucose because glucose is needed for energy. We're going to talk about this under metabolism, second semester. This is what I was talking about a minute ago, vasoconstriction of the splanchnic beds. That's the intestinal tract and the liver and the stomach and so forth, and skin. But vasodilation of skeletal muscle, beta 2 effect. And then adrenal medullary secretion, which I mentioned, pupil dilation. The parasympathetic system conserves and restores energy, so that's what kicked in after the turkey dinner, and dominates control of motility and secretion. Sometimes a lot of the older textbooks, they say a good description of the parasympathetic system's activity is SLUD, S-L-U-D. It's not slug, that's that little snail thing, it's SLUD. And that stands for salivation, lacrimation, urination, and defecation. Man, that's a great family of stuff, isn't it? Spitting and crying, anyway. So all of that is controlled by the parasympathetic system. Here's another summary from another book. You don't have to memorize all these charts, but if you look through them, it's kind of neat because everything on here makes absolute sense, and you can go through what is potentiated by the sympathetic system, what's potentiated by the parasympathetic, and it should make, you know, tremendous sense, each one. We haven't talked about urinary function, but here's the pancreas, stimulation of fat hydrolysis. That's breakdown of fat to provide more glycogen, and then glycogen is broken up to provide glucose. Everything there makes sense if you spend some time with it. Okay, so I don't have eye clickers, so let me click over to, oh, why? I haven't even looked at them. I think most of them are covered. Let me go ahead and do the review in the past couple lectures. Okay. So, as I said before, our final exams is coming Tuesday. You have a whole week. That's more than you've ever had for mine. You're going to be so